use in resuscitation. And the pertinent point was made in this morning's presentation that to be of maximum benefit, we need to get it attached to the patient really quickly. The suggestion being that in a UEFA stadium, you should always be able to get your AED to a patient within 2 minutes. 2 minutes is a lovely target, but often in the real world, outside of organised events, it's quite a challenge. How do we know where the nearest defib is? Yeah. And what we're going to look at this afternoon is some presentations of some of those challenges and how different places are beginning to overcome them with mapping systems and ways of locating your nearest shock box. So at that, I'm going to hand over to our first presenter. Probably needs no introduction from me, because I think most of you do know. Benoit, the floor is yours.
Thank you, Stephen. Thank you, everyone. Yeah, sure. Thank you. So, hello, everyone. I'm Benoit Vivier. I'm Public Affairs Manager at EENA, and among my fields of expertise, I work on mapping automated external defibrillators. And I will share with you a few things we've been working on, especially through the Galileo for AED project. And I will tell you a bit what it is. But first of all, I'll make some links with some discussions we've had or this morning in plenary, actually, about the importance of having defibrillators around, and especially knowing where they are. So these are a few stats, and most of us are familiar with them. But so we have a lot of sudden cardiac arrest in Europe, and it's one of the major causes for death, of course. And the chances of survival increase by 10% for every minute passed without performing doing any intervention, so defibrillation or a CPR. And typically the survival rates of out-of-hospital cardiac arrest would vary depending on the countries from 5 to 15%. But actually, when you perform a defibrillation in less than 3 minutes, and we've heard some very interesting and inspiring story this morning, the survival rate goes up to 75%. So this shows the importance of very quickly having access to a defibrillator when you have a sudden cardiac arrest. I'm just going to share a few things about the project we've been working on with EENA, together with the companies that you see listed here, so Vivier, GMV, RNP, Alter, and so EENA, and I'll share with you a few findings that we had from that project, and actually that will help us to introduce a bit the session today. So the overall goal of the project is to improve access to the location of AEDs in Europe. And so for that, we look at the best practices on mapping AEDs in the different European countries, try to define a list of requirements per stakeholder when developing a digital registry of publicly available defibrillators. We look at some legal challenges in Europe and try to find how to overcome these challenges. Try to provide sometimes some recommendations also to the decision makers. It's an expected output from the project. And also we try to assess the added value of having a pan-European registry of defibrillators, or at least to integrate the different European initiatives. And finally, something we've been doing also is to develop a prototype where basically when someone calls the emergency services asking for help or to witness a sudden cardiac arrest, basically to be able to send to that caller some information by SMS on where the nearest defibrillator is located. So this is something we've been doing in this project, and this is currently being piloted in some European region. So first of all, to introduce the whole session today, I just want to recall what's an AED. So AED is automated external defibrillator. So it looks like that device. So you have first the device as such, and then you have two pads that basically you have to apply on the person, victim of a sudden cardiac arrest. So what does this mean, automated and external especially? So automated, it's because you have different type of defibrillators. The automated basically would look at your cardiac rhythm and automatically perform a defibrillation based on how your cardiac rhythm is actually. Then you have the semi-automated defibrillator, where basically you have the device analyzing your cardiac rhythm, and then it would just say, now activate the defibrillation. And so this is a semi-automatic one, because the user still has to basically press one button to defibrillate the victim. And then you have the manual ones, but this is more reserved for doctors. And the added value of automated defibrillators is that anyone can use it. Like, I don't have any medical background. I just know where to put the patches, and then the device does the job by itself. So this is what an AED is. It's this type of devices, and this is what we're going to speak about today. And we also include actually the semi-automated, which are usually ranged together with the AEDs. And actually, so just to go on defibrillators. Yeah, I'll just add a few things that now we have like second generation of devices of defibrillators, where you have basically additional chips which can provide additional information to like any registry or any owner or any public authority, where you have like information such as the position of the device that can be available, but also the battery status. Sometimes the device would do some checks automatically, for instance. And something that is interesting also is that it's possible for several devices now that basically whenever they're used, an alert can be sent to the emergency services to say the device is being used. So then the emergency services can know that something is happening there. Maybe the nearest hospital can be alerted as well. So that can be useful to gain some time. And we've seen earlier in the first slides how important time is it when it comes to using defibrillators. Okay, so some important considerations when we look at defibrillators. So first of all, and it might sound obvious to many of you, but it's important to recall that they should be installed in as many places as possible. Of course, we spoke about it this morning, and we know that in a large sports event, for instance, it should be within 2 minutes of reach to anyone. And so it's important to install defibrillators in crowded places, but also we can consider places with higher incidences of out-of-hospital cardiac arrest. So that's the case, for instance, in the sports venues. When you do gym, for instance, you have higher incidences. So it might make sense it does make sense to install defibrillators also in these places. They should be easily identified, and now we have some kind of harmonized logo a bit everywhere. We use this logo to say there's an AED here, and it's important so that people can see quite easily that here there is a defibrillator. And also what is very important is that people should know where they are, because one thing is to have defibrillators, but if like you guys and we don't know where they are, then it's useless actually. So it's important to have ways for people to know where the nearest defibrillators are. And finally, the population should know how to use them. And you might think that this contradicts a bit with what I just explained, that the defibrillators are automatic. It is true, they are automatic, but it's still important to know where to apply the patches, for instance. But also, if you've never used a defibrillator, or if you haven't been briefed on how to use a defibrillator, of course you wouldn't feel very confident on using it. So it's important to train the population on, first of all, performing CPR and then using a defibrillator. Everyone should know how to do it. It should be mandatory, and that's the case in a few European countries. And the survival rate of the out-of-hospital cardiac arrest actually are much higher than in countries where people don't know how to perform CPR. So what's AED mapping? So AED mapping is basically the fact of having a digital a digital map which can be accessed and is regularly updated via internet. Can be a web service, can be an app. And that gathers information on the existence and the location of the publicly accessible automated external defibrillators. And the final objective is to increase the survival rate of the victims of out-of-hospital cardiac arrests. So, and I want here to highlight that there are actually different strategies between the countries in Europe when it comes to AED mapping. Many countries have an AED mapping, but sometimes the way to do it really differs a lot from one country to another. Sometimes it comes from a public initiative, sometimes it comes from a private initiative, sometimes it's like a consortium, sometimes it's a foundation. So you have different origins actually of the initiative to develop digital registries of defibrillators. Sometimes it's also a regional initiative, while in other cases it can be national. something that is quite important actually is that you have a few countries, and that's the case actually now in France, that whenever you buy a defibrillator, it is mandatory to have it registered in some kind of registry, and that the authorities should know where these defibrillators are. While in most countries it's actually voluntary. And of course, if it's voluntary and people don't know about the existence of this registry, you won't have a lot of devices that are mapped in the registry that you develop. And then another difference between the countries is that you have some countries where only the PSAPs can know where the defibrillators are, while in other countries you have access for general public. And this access can be either via an app or via websites. So you can see that here there's it means that basically every country has a different approach to AD mapping, because there's a lot of variables actually. So, and we'll hear today just two of the cases, but then there's other examples in other countries. But what we see as a global pattern actually is that usually the AD registries, when they exist, they contain the following information. So one is the geographic position of the device. So you have the position on the map plus the address, which is important. And especially when we speak about the address, actually, what's important is that often the defibrillators are located indoors, inside the building. So then it's important to know how to reach the device once you're inside the building, and also on which floor it is located. Then you have instructions on how to reach the defibrillator. So as I just said, the opening days and the opening hours of the building, because of course if it's in a school, for instance, the school is not open every day, so it's important to know that when you develop a registry. Sometimes the defibrillators are also locked in a box that are locked, so it's interesting to add the access code actually to that lock. And then you can add also information, and sometimes that information is not always displayed in the registry, but it's important for the developers of the registry to know a contact point for the organization who owns the defibrillator, and also the days of the last checkup, for instance, and the last renewal of the batteries and the electrodes, and information also about the brand and the model of the device can also be useful, though it does not need to be public. A few challenges for authorities who develop AED mapping. The main challenge is sometimes to get the AED owners to register their device, because sometimes they don't know about such a registry, or they don't see any added value. So it's important to convince them to have the device registered in the registry that is developed. But also it's important to make sure that this information is accurate and is updated. Whenever the AED owner changes the place of the device, it's important that this change is notified in the registry, because when you develop an AED registry, it's important to make sure that it's accurate and the information that is there is accurate. And of course, you always have issues like the privacy of the owner that must be taken into account, and some cybersecurity issues when you have a web or an app with such information. Another challenge is a legal challenge. In many countries, especially in the south of Europe, not everyone is allowed to use a defibrillator. And in the countries that you see in blue, you actually need to have some prior training to be using the defibrillator. And so that contradicts a bit with what I've been saying, that an AED is automatic, so you don't need to know how to use it to basically use it. And despite that, it's not allowed to use it in a few countries. However, in countries like Italy, for instance, or in Spain, if you still use it without having done a training, you wouldn't have any legal prosecution. So it is fine, but legally it's not allowed to use the defibrillator. And then you can also enhance the AED registries with additional tools, I may say, or additional information, additional functionalities. For the people, it's for instance, you can add some link to the navigation app. So basically, when you click on the defibrillator, I've seen that in the Finnish registry, when you click on the points on the map, it will tell you, for instance, via Google Map, how to reach the place quickly. And of course, that means a lot of time saved to find the defibrillator. For the PSAP, it's important to have that registry integrated in the GIS of the PSAP so that the call taker can directly see where the nearest defibrillator is compared to the caller, and doesn't have to use an external functionality online and so on. So it's interesting to integrate that directly in the command system of the PSAP. And it's important also to add some first responders programs. So we'll hear about it a bit later. But for instance, the possibility for PSAP to mobilize people who know how to do CPR and to basically be able to send them on the scene of an incident so that these people can be there before the ambulances and can already start the cardiac massage and so on. So that's also some time saved, and so that means some lives saved in the end. And finally, something we are looking at through that project is the possibility to send an SMS to the person calling the emergency services with the navigation instruction on where to find the nearest defibrillator. That's also sometimes that can be saved, and some help for the caller on where to find the nearest defibrillator. So that's it for my presentation. I'll happily take some questions if we have time.
Yeah.
And,
I think we've got time for one or two questions. Are there any questions for Benoit? You're going to have to wave because in the light I'm struggling to see anyone. I think you got off lightly. Well, thank you very much, Benoit, for introducing the concept of what is an AED and how we map them. Take a pleasure to introduce David Friedman, who's going to explain the first links in the chain of survival and the experiences of AED mapping and the dispatch of both the machine and the volunteers to use it, as seen in Sweden and Denmark.
Yeah, thank you very much for allowing me to present and for the fine venue and warm welcoming here in Marseille. Me traveling from Sweden, this is a nice Swedish summer day. I acknowledge you people wearing down jackets and hats. Okay, it's not for me. Thank you very much. I'm going to talk about strengthening the first link of survival. I'm a PhD from Karolinska Institutet, but also operations manager of a company called Heartrunner that actually use AED information alerting volunteers. Some conflicts of interest. It's really small readings there. Out of hospital cardiac arrest, maybe me and Benoit should have synced a bit better. We're going to go through this. Cardiac arrest is common and lethal. It's the leading cause of death in Europe. 350,000 deaths every year. Low survival rate, around 10% in average in Europe. But it could be easily actually increased by early CPR, someone doing assisted circulation or providing an electric shock from an AED could increase survival up to 70% or even higher. This is the chain of survival, and I think some of you may have seen it. It was introduced in the 1990s. Each link is dependent on the previous. First, early recognition and call for help. That's the 112 business. Then it's early CPR, defibrillation, and then it's the hospital taking over. Could be hypothermia or treatment with whatever drugs or things. But this is the actual reality, because not all links are equal. This is a publication from 2018. It's a bit saddening, but it represents this, the circle size represents the percentage of patients. 100% of all the cardiac arrest patients are involved in some way in a 112 call. But only 48% of, in this case, I believe it was over 60,000 cases of cardiac arrest, only 48% of them actually receive CPR. And only 12% are treated with an AED. So, of course, we have a low survival rate. But we need to keep more people sort of traveling through the chain of survival and keep them in the links. And that's an idea of sort of performing CPR, giving telephone assisted CPR from the dispatch, and also AED mapping. So AED referral by dispatchers, it was acknowledged in the European guidelines. Things are messing up with my screen, but it seems good that you can see it actually. AEDs are sold in thousands every year, but will remain unused if no one knows what they are. If you don't know where it is, it's highly unlikely that you would pick it up. An AED referral was mentioned in the 2015 CPR guidelines, that this is something like the community response saves lives. When you call 112, you should be guided to a nearby AED. It's a super clever idea. but how's that going to work if no one maps the AEDs? So it's a good idea, good initiative, but it needs to be sort of worked on. And to accomplish that, knowledge of AED location, of course, is necessary. In 2009, I was involved from the Swedish Resuscitation Council to establish the Swedish Ada Registry. It's nationwide from the start. It's managed by the CPR Council. And AEDs were available for call takers at PSAP since 2012. And today, or last week, 19,000 AEDs were installed in the AD registry. And one of the things that's worth mentioning here, and also for Benoit, it was a struggle to have the AD vendors and the companies to actually be in the same room collaborating around even providing us figures of how many ADs are sold so that we know are we covering 20% or 50% of all the sales. They really weren't keen on collaborating. And I wish you all the best when you're going to set up an AD registry in your country. Make sure that you have good connections. It's really valuable. And that's one of the things that EENA is providing. This is a good sort of starting point for collaborations. This is a map of Sweden, and just keep in mind there's a little small white thing in the southern there. That's Denmark, just to show you the difference, because I will briefly touch upon the Danish Id Registry. So this is what it looks like when you access the AD map in Sweden. They show you all the points of locations. You have the access hours, and you can see where it is. Currently, you don't easily see a picture of the location on the house. But they're working on it. And this is the influx of ADs the last year from 2015. And it's interesting to see that there is a sort of a slightly decline now, and it's even worse when you look at last year due to COVID-19. Most likely, since things happened in businesses. Often this is companies buying an AD and making it available. But then when the reminder email about keeping the AD registry updated, it bounces. Well, maybe they changed the emails, maybe they got out of business, and sort of we see a decline in the number of registered ADs. But it's interesting to see that once we made it above 10,000, it's sort of going up there. And we're trying to make some initiatives to reach out to the vendors. Whenever you buy an AD, it should be encouraged that you should register it. But there are currently no structured campaigns, and there is less resources as well for community reach out from the CPR Council in Sweden. And on AD mapping in Denmark, I've had the privilege to work quite closely with the Danish Safety Foundation. And I think that the Danish AD network was the first in Europe to be established in 2007. It's managed and maintained by the Safety Foundation. National coverage in all the 5 Danish regions in 2010, and was actually available for dispatcher at 112 as early as 2011. And it's sad to see that they have more ADs in the registry. They have half the population of Sweden, but still they are sort of beating out in the AD registries. I guess today it must be over 22,000 ADs. And also interesting to say, they have assigned PhD students to focus on the AD registry and the benefits of it at PSAP, in the pre-hospital settings. And this is something I really encourage. And if you're lucky enough, this is a really interesting way for publishing research. This is the way it looks. You see that Denmark is really, really small compared to Sweden. And it's massively densely populated if you compare it. The green dots, those are available 24/7. The yellow ones, they rely on access hours for venues like shops or gyms. The red ones, they are locked in and you need some kind of access code to access it, so they differentiate it with colors. This is also a bit discouraging from a Swedish perspective. They had a tremendous increase of AD installations. And most impressive that this little on the right side, that's the graph for 24/7 available AEDs. And they have had massive campaigns. Actually, they have a call center. If you enter your AED into the Danish registry, someone calls you up. If it's not available 24/7, they ask you to make it available 24/7. Could you consider placing it outside in a heated cabinet? Could you improve your access hours in some way? Okay, great, thanks. And this is something that I really would like to, for whatever's coming in the future, to encourage to improve the accessibility of AEDs, because they will not be used if you can't reach them. And then I'd say almost a waste of investment. When Denmark installs AEDs and make them available, they also use them. The orange graph, that's actually bystander CPR. So they're reaching 80% of all the cardiac arrest victims in Denmark. They receive CPR from a bystander. This is really impressive. The green graph, that's the percentage of cardiac arrests where someone uses an AED, a publicly available AED. And when that increases, you also increase the survival, which is the red graph. And they had a slightly decline due to the COVID-19 pandemic. So it's clearly that structured efforts and strategies pay off, and Denmark are today among the leading countries in cardiac arrest survival. And I congratulate them. If there are any Danes in the publics, congratulations. I tip my hat to you. So why should we map AEDs? My most common answer is to make use of the investment. If you spend your money, make sure it's used. Otherwise, you could keep your money. If you lock it in, then almost a waste of money. An AED that no one knows about will never be used, and that's when we end up in this representation of the chain of survival. With only 12% actually defibrillated, with all the AEDs available, we could do a lot better. An AED mapping in the Swedish and Danish context. We want the AEDs to provide better care for citizens and to use them. The available resources should be used for the common citizen. So it's free of charge. It's non-compulsory, but encouraged by all the distributors. That goes sort of up and down a bit, depending on how well we reach them. And it's also vendor agnostic. And I know that most of the AED vendors, they actually provide some kind of AED registry for their own devices with maintenance, and they could be connected to the internet or whatever, which is great, but that's only for those ones, not for everyone. So perhaps a collaboration between the vendors' registries as well could be something in the future. And then from my standpoint as well, research is really important. You could analyze AED use to actually see that if you make an effort, you get a different outcome. You can analyze AED distribution in society, density, we'll tie it to population, tie it to cardiac arrest incidents, and you can find better placement. Like Benoit mentioned, we always end up sort of pointing out to train stations and sports arenas and sort of where a lot of people actually exist during the day. But what's said in the guidelines, it's also densely populated areas should have AEDs. And this is where we miss out. Because it's easier to identify a football field or a sports arena. And you always know who owns it. So it's easy for them to buy 2 AEDs and ownership is guaranteed. But who's going to take care of your neighborhood? Who owns it? Who's going to maintain the AED? Lots of housing opportunities or different buildings. So we keep forgetting around 70 to 80% of all the cardiac arrests, they occur at home. So we miss out on those people. But one of the last things with an AED registry, and I really stress this, you could extract data after use. So you have your ECG, and you can find out actually what did we do, what was the primary rhythm, are we doing anything good, could we improve, and how should we improve? And that's something that I really would like you to stress. to have it in place. It's costly, and they actually make it in Denmark. But AD availability, that's critical. An unavailable AD would never be used. And in general, it fluctuates greatly over time. In Denmark, they had massive campaigns pushing for 24/7 availability, and they really make a difference, like I showed you. And 63% of all the AEDs in Denmark are actually available 24/7. And in Sweden, it's only 50% that actually are available after office hours. And this is a graph, and I hope everything works. These are actually, it's a clock. So going up there, that's the office hours, and on the downslope, it's nighttime. And then something happens in the weekend. This is Saturday, and this is Sunday. So we're installing AEDs in offices. So if you have a cardiac arrest around lunch, no problem. But around 8 o'clock in the evening, then you have to wait for the ambulance. I don't think this is clever resource management. We could change this, it's no problem. And the logic of AD mapping is clear, but the effectiveness of it is yet to be proven. But there is systematic use in Denmark of referring callers to AEDs. And there's also ongoing research to analyze how effective this is. So when someone calls 112, the dispatcher can refer the caller to the nearest AED. And then the AED is removed from the map and only brought back when it's verified by the owner that they have batteries and pads and everything is in place. Until then, you cannot see it on the map. So it's really clever that way as well. And they have structured data extraction in Denmark in 4 of the 5 regions. In Sweden, we're not that good. We're struggling with the data extraction, and also we struggle with the referral at 112, which is discouraging as well. But automated reminders is something that could be really interesting here. And this is one of the main questions that I get when I'm talking about this. Are they willing to let the AEDs be used? And in Denmark, the electrodes and batteries are replaced if PSAP are referring to the AED. So then you get the reimbursement from the regions, which works fine. In Sweden, we do not do that, but still AEDs are used. So owners are actually willing to let anyone use the AEDs, and I think that's really heartwarming to see. One of the things that I focused on in my research was the AED referral and barriers for AED referral at PSAP. And it's a chaotic 112 call, lots of things going on. An AED referral is closely tied to telephone-assisted CPR. And sometimes it's hard to interact with the caller. So we've got language barriers and all these things. And a method of automation for reminders for the call takers, I think that's super important. Because I identified sort of important barriers for why not referring callers to AED. They're unwilling to act, or maybe not at the patient's side. CPR is already started, so they don't interrupt it. But most common, they actually fail to remember. So we spent the money on buying the AEDs, creating an AD registry, linked to the PSAP, and they forget about it. We could do better. So community response saves lives. It's doable, it's easy, and it's worthwhile. But what could we do if this is hard? If we're struggling with dispatch from 112? We'll put legs on it. Dispatch of volunteers. This is actually advocated by the European Resuscitation Council. They say use technology to engage communities, alert them through smartphones. This is what I represent in the Heart Runner company. Someone calls 112, emergency call centers, they send out the call for ambulance, and nearby volunteers are alerted simultaneously. And they also are guided to nearby AEDs. So they hopefully can be there before the ambulance, since they are closer, and they can bring an AED. AED use increased in Danish regions when installing a system that alerts volunteers. Today, 5 of 5 regions are using a system to alert volunteers in Denmark. 11 out of 21 regions in Sweden do it. a dramatic increase in bystander defibrillation in Copenhagen when they analyzed this strictly in the research, going up from 7% to 21% when volunteers were first on scene bringing public AEDs. And this is also encouraging. This is what we want to happen when we have an AED registry. Bystander defibrillation also increased significantly in cardiac arrest in public homes, in private homes, sorry. 980 cases in Denmark and Sweden. 80% of all these cardiac arrests occurred in a private home. And 17% were defibrillated when a volunteer arrived before the ambulance, bringing a publicly available AED. And these are patients that we hardly use. These ones they don't survive because we don't access them quick enough with the ambulance. It's still unpublished, but it's presented in a thesis from Copenhagen. You could look it up when it's coming out. Today, over 140,000 volunteers are enlisted as citizen responders in Denmark and over 110,000 in Sweden. You can opt in if you're over 18 and you know how to do CPR. Volunteers they responded to over 6,500 alerts last year. That is during the COVID-19 pandemic. And the best part, that's when I get to call them and say, well, you remember you got this alert last week? Yeah, she survived actually. She did something right. It's great. And this is an encouraging tweet from Carolina Malte Hansen. She's a physician and researcher in Copenhagen, asking, what are your community doing to increase survival after cardiac arrest? And I would suggest create an AED registry, link it to the Peace app, and get yourself a system that alerts volunteers. So you actually make use of the investments. Thank you very much for having me. Sorry for the bit stressful presentation. Made it 8 seconds on the clock.
Yeah. Do we have any questions from the audience? There's one.
Oh. Okay, try that again. You mentioned how 85% of cardiac arrests occur in the home, whilst AEDs are predominantly available in public areas, and how we're going to bridge this gap. Is there an area with or industry for vendors to look at making AEDs smaller and more cost-effective for these to start becoming more common parts of people's personal first aid kits at home?
Yeah. We know there has been a shortage of semiconductors in the world. Otherwise, I think we'd seen this already. And it's kind of weird that AEDs are kind of the same size as 10 years ago. But I've seen things happening. They're getting smaller, cheaper, single use. I don't know. Yeah, but things are happening. And I think that's really good. But having an AED in your own home has proven being ineffective. Because when you have a cardiac arrest, no one else can use it since you're already dead. It should be maybe in the entrance or some kind of when everyone can access, or locked in a cabinet outside, heated, preferably, at least in Sweden.
Yeah, because one of the things I've noticed as a call taker and a dispatcher is that we have a thoroughly high increased volume of chest pain calls over the pandemic due to chest pains being a COVID-19 symptom. And thus, because we have so many chest pain cases, people are waiting 2, 3, 4 hours for an emergency response. And if early defibrillation or the use of an AED to stop a cardiac arrest actually occurring in that time frame, whether it would start being more beneficial to the public.
Yeah, and I think we're going to see things coming out of the pandemic when we're looking at actually chest pain patients turning into cardiac arrest patients at a higher rate than they used to, since they don't want to take place in the ER. So, yeah. Did I answer your question? Sort of. Thank you very much.
Yeah. Thank you. And moving on, I'd like to introduce Stefan Spielbichler. I hope I got that name right again.
Nice try.
For the Austrian experience.
Yeah, thank you. Thank you for being here. Thank you for providing our vision, our idea of providing AEDs to the community, to all people who needs them. And We started 10 years ago our vision together with an organization called Pulse, or Puls in German. It's an organization, different kind of people working in different healthcare jobs to increase the outcome of out-of-hospital cardiac arrest situations. And one idea was to implement an AED mapping. It's called Defi-Netzwerk in Austria, in German. And feel free to Google this site. What was our vision? Our vision was to have all AED locations available for the public, available for the PSAPs, based on crowd data. So everyone can registrate an AED, and it must be implemented in the dispatch process. So, like we heard before, the AED without the mapping and without the implementing in the PSAP makes nearly no sense. So, in the meantime, it is a big network together with the Austrian Resuscitation Council, the medical universities of Vienna and Innsbruck, the different EMS providers which are using the AED mapping in Austria and working for that. So, an overview of all AEDs in Austria, and I wanted to show you the map really where you hardly can imagine where Austria is. And when you see the defibrillators with some small holes in it, but now you can imagine where Austria is. So as I told you, everyone really is able or may report a location. Everyone who goes by can look and Google if there is a AED, and if he found or she found an AED, the registration is possible for everyone. So we set up a simple user verification via SMS token, so the user has to register it once and can report a new AED location. The entry now then is temporarily displayed. It's marked that it's only temporary, and there is a location verification via an admin team, or the EMS staff is asked to verify if the location is correct and the information is correct. And so the AEDs are displayed with different colors. The colors in Austria means something else, like it is in Scandinavia. The yellow cross is verified by the admin team. The red cross is verified by EMS, and the white cross is not verified, but it should be there. And everyone can indicate that the AED is not working. And as I told, the verification is done via EMS staff or the admin team, and we provide benefits for them, so that we encourage them to do more verification, to do more, to walk through the life with open eyes to see if there is an AED or not. And we made some competitions, and the one who made the most verifications got a new iPhone and new tablet, and we try to make it in the next year more to overcome with new locations and verified AEDs. That's how it is displayed on a simple website. The website can be used on smartphones, on tablets, or on PCs, and it's indicating the address and some. It's nearby to the toilet, in the middle of the area which is under the roof. Maybe like this one it's on a motorway station. And it's with different photos in 3 categories: an overview and detailed view, so that the public can see where it is. Also, the dispatch centers, the PSAPs, can access the photos and can guide the bystanders to the AED location. We now have, this is the figure of last week, nearly 7,000 AEDs registered in Austria, different motivational in the federal states. So we started it together with Vienna, and you see Lower Austria and Vienna on the upper right. So there are the most. Tyrol has is now getting to the lead to another federal state. Who owns the AEDs? Maybe you can read that. 30% is business owned. 21% are private owned AEDs. 19% are owned by the municipalities. 7% by EMS, fire, rescue, police, which are partially accessible by the public. 2% by authorities, and 3% different associations and organizations, and the 18% is different miscellaneous owners. The wrong one. Some pictures. In the bigger one, this is a municipality where the AED is located. This is the monastery of Salzburg, which is also, and this is the highest AED in Austria. It's 3,106 meters on the observatory of the Austrian weather service, and it's in the living room of the technicians there, and it's also indicated in this mapping. So as we heard, it's makes sense that you map the AEDs also in public areas, also in private areas. Only one federal state has no direct links to the PSAP. We are working on it, but it will take some time. But every other federal states, the dispatch centers are linked, so they have implemented directly in their dispatch process. And I want to show you how we have implemented in our dispatch process. We use a standardized interrogation system where about 1,600 dispatch codes. You get a dispatch code, and in 57 we know that most of them an AED could make sense, or is you have to use an AED, like traumatic injuries, cardiac respiratory arrest, falls, assaults, electrocution, lightning, breathing problems, drowning, not breathing, unconscious, overdoses, allergic, and under other dispatch codes. So if our CAD system indicates one of these dispatch codes, we change our normal dispatch work. So the first call taker, the emergency medical dispatcher 1, does the interrogation, sets the level of care, gives some pre-arrival instruction, provides dispatch life support, and if one of the dispatch codes is in use, there, and the dispatcher, the second one, is alerting, dispatching, and follow up the EMS service. And a second call taker calls a second bystander. If there is a second bystander, we call him directly, and if we know from the AED mapping there is an AED nearby, so we ask the first bystander, is there a second person, so we can call them directly and guide through the process how to get the AED and get the AED back on scene, where the first bystander provides telephone-assisted CPR. And the second version is using the Lifesaver App. The Lifesaver App is created by an association. They contacted us and said, okay, we want to set up a Lifesaver App where different kind of people can register and get alerts to get as first responder on the scene and gets alert to provide an AED on the scene. So the first two users are guided to the location of the out-of-hospital cardiac arrest, and the third or fourth user are guided to the next AED location. Like when there is a cardiac arrest, the dispatch center sends out the alert also to the Lifesaver app, so everyone which is nearby gets the alert, and the first two who confirms the alert gets the routing to the location of the cardiac arrest, and the third and fourth one will provide the AED. Who can register it? Everyone who is registered as EMT, as medic in official systems. The mountain rescue service is included in the service, and everyone who's first aid certified. So the EMS organizations who does the first aid courses try to get everyone after the first aid courses to be a lifesaver and registering as lifesaver, and every couple of years they have to prove and they have to certify their knowledge to provide CPR and using the AED. The facts, when we look at Law Austria, we have a population of 1.7 million inhabitants. We had in the last year about 18,000 matching dispatch codes. In 109 events, an AED was already on site, and in 35 events out of the 109, the AED was already in use when we received the emergency call. In 5,000 out of the 18,000 calls, there was an AED available to get them in a couple of minutes, and in 46 cases it was possible, so it was nearby enough, and there was a second bystander. In over 4,000 cases it was not possible to get the AED to the location, because half of the cases there was only one bystander and no second one, and the one bystander has to provide CPR and not to look for an AED. Over 400 callers were non-cooperative, and in 2,600 to 2,700 was the EMS too fast on site. 783 we have no data recorded. Yep. Thank you. Do you have any questions?
Again, thank you very much. Any questions from the floor?
Merci. Hello, Christopher from Luxembourg. Just a question of a precision. When you say you sent out bystanders via the application, and you mentioned it in your data, what do you call too far? What distance do you consider as the PSIP to say, okay, that's not too far?
That's an algorithm. It's calculating the time which needs the EMS to be on time, comparing with using Google Maps walking distance to the next AED.
Okay, great. So it's dynamic. If it's on the countryside, you
Yep.
maybe send someone out a kilometer or two to get an AED, and in the city maybe not, because the ambulance will
That's
be there
correct,
in
yeah.
5 minutes. Okay, good. Thank you.
I think there's another one at the back.
Yeah, sorry, Mick O'Donnell from Dublin Fire Brigade. Just a quick question, I suppose, for all of you. How big do you think the maintenance or upkeep question of the AED, the maintenance, making sure that it's working, you know, in terms of keeping that information live on the system, is that a difficult one to solve?
You mean if there's a control function of no, that's one of the thing we are working on it. That's a real big problem to indicate if it's actual and information is right. As we heard, the site is closed in the meantime. There is no bank where the AED was located.
Can I fill in on that? In Sweden, we email every 6 months and ask you to check for live electrodes and batteries and that everything is functional. But we know that, well, things go out of business, or you change your last name, or well, maybe you're on parental leave and someone else is supposed to answer that email and no one does. And I'd say, well, from my perspective, it's worth sending anyone to the site of the AD anyway, because even though we haven't verified it today, it might well be functioning. Because if we're going to rely on these sort of Ethernet connected Wi-Fi things, that's a bit in the future. And in the meantime, people die every day from not using AEDs, not even trying to use them. But yeah, it is, of course, an issue.
I think rely on the technique is the way to the future.
I think there was another question at the back. Yeah.
Thank you very much. This is Stefan Trümpler from Hamburg Fire Department. Thank you, Mr. Spielbichler, for your presentation. Your data shows something that I find very intriguing, because the last slide you showed, it says very few AEDs are used, but this data is really amazing because it shows one thing. On the one hand, you put a focus on guided CPR by one bystander. So you put the focus on the right thing. If there is only one person to help, push and breathe. That's what we need. If we have more than one bystander, get this AED. That's right. But you put the focus on the right thing. And the second one, EMS too fast on site. It kind of shows that your EMS system seems to be quite in order, because you're so fast that even first aid by bystanders is not faster than your EMS system. Congratulations to that. Thank you very much.
I don't think that the EMS is so fast. I think there are in the out of hospital cardiac arrests take place in places where there is no AED.
Were there any more? One question from me to the entire panel then, and if anyone in the audience knows the answer to this one, please shout as well. But do any of your apps show us where the nearest defib is to here? Here? Yeah. Yours works. I think that's got to be the next challenge, is the interoperability across Europe. We're all collecting this data, but most of us are not in our home countries. Quite a few of us have our home app on our telephone, and I don't think it's anything that anyone really does is to download the app of the countries they're visiting.
I think that was what Benoit was touching upon. We maybe need a pan-European AD network. And we struggled to get the vendors in the same room in Sweden. Yeah, let's do it. We got large rooms here, just invite them and get things working. And just one thing, touching upon that, yeah, we don't have the app for it, and I haven't heard anyone in the venues here telling me where the nearest AD is today when we're gathering, I don't know, a few thousand. Yeah. This is a high-risk area for cardiac arrest at the moment, since we're a lot of people in the room. I don't know where it is. Yeah, you have it. Great. And I'll just keep track of you then.
But why doesn't Google provide this information?
Yeah.
In London, I can find the AED on London.
Yeah.
Yeah, interesting, yeah, because there is a map on the wall outside the door here showing where all the fire extinguishers are.
Yes.
And it's been well proven time and time again the AED is more likely to save your life.
Yeah, it's more likely to have a cardiac arrest than a fire then.
Indeed. At that, I'm going to say thank you very much to the panel and to all of you. If you want to stay here, the next session is going to be using data to anticipate and predict and respond to emergencies. Back in the plenary room, track 1, the session focusing on public warning and moving beyond the technology mandate, or in track 3, we have another industry session. So it's a fairly short time frame to move between rooms if people don't mind.